The first question: what is muscular testing? This is a clinical diagnostic method. What does it show? It shows how adequate the response of the muscular and nervous system is to external or internal environmental factors. Why? It's because we all want to be healthy, and we all know that health is your body's adaptation to the outer environment. Energy, substance, and information. If our response is adequate, we're healthy, and any environmental impact supports and develops us, while if we are unable to adapt, we get sick. Manual muscular testing leads to understanding of the fact that either we are friendly with the environment or it destroys us. It's not only the external environment. There is this nice picture here below. Look, it's the inner environment as well. We are not always adapted to the inner environment, but what is more important is that manual muscular testing is used as the biological feedback method. This factor can be the most important because you don't just evaluate your condition and how adequately you react to the external impact, you also understand what can be done to restore your health. Why is that important? Because we are all humans and we can never fully understand how we are designed. Imagine we are inside an elephant and we don't know what the elephant looks like externally. We can just humbly ask our body if what we do is good for us or not. It means that the modern medicine turns a doctor from the king of the process to a humble assistant of the patient's body, because it's the patient's body where biochemical reactions, energy exchange processes happen, and we can only help or harm. It's crucial that the doctor's knowledge helps and doesn't harm the patient. The method of the biological feedback is very important here. Any motion of our body is initiated by a command of our muscles, organs, and systems. There is nothing in our body which could happen just as it is, without any connection with the other organs and systems. Please look at this amazing picture created by Nikolai Alexandrovich Bernstein a century ago. Any motion is activated by several commands. A command center which sends a command, the muscles which perform the command, and the motion is the result of this work. Then come the sense organs which analyze if everything was correct. The recording devices check if the command was performed correctly, the programming device, and the recoding center. Why is that so complex? It's because any motion we perform is perceived by our body as an exercise, and the body tries to do it properly. Here you see a hammer. A person hits with the hammer trying to do it as short and less costly in terms of energy as possible. Any motion starts with a command. Here you can see it. I want to hit with the hammer. The signal is received by the muscles. Some muscles contract while the others stretch, while the others get stabilized. There is load, the shock is performed, and the sense organs decide if there was the shock. Yes, there was the shock. Did the muscles contract? Yes. How? Some muscles contracted, some stretched, some contracted, some stabilized. It is recorded if there were enough motions, if the muscular effort was adequate. Then the sense organs send the signal further to the recoding device. The muscles send reports and sense organs send reports as well. The device synchronizes with the command. If it was that command that had been performed, the recording device checks again if the task was actually given. If something is wrong, the programming device reports if there was some difference between the performed motion and the decision. It leads to the result in the recoding center, which says that the performed motion does not correspond to the program and it should be performed again. The command is sent again. When the same command is repeated many times, the training system is formed. Why am I telling you that? Because to perform the manual muscular testing properly, we need to understand that the muscles perform the motion, what results of the motion you have, And the more sense organs participate in this process, the better the work of the recoding and recording devices of the recording center, and the faster you will learn to do manual muscular testing. This wonderful scheme was created by Nikolai Bernstein nearly 100 years ago. He was persecuted for that, so very few medical experts apply this system of the biological feedback, and we are now bringing it back to life.